episode of Letstalkfurreal. I'm Mary, and I have with me my co-host Derrick, and today we have Dr. Kevin, veterinarian from Companion Animal Surgery. Hi, Dr. Kevin. Thank you for being here today. Please tell us a little bit more about yourself.
Hi, I am Dr. Kevin Verhoeven. I am currently a vet at Companion Animal Surgery. I've been a vet for maybe about the last 4 years. Yeah.
All right. So, what sparked your interest in this industry?
So, growing up, I was always a bit more of a sciencey kid. I always wanted to do something in that particular field. I remember when I was a teenager, 16, 17, just before army, I used to volunteer at the zoo. So a big part of what I was doing was basically like prepping food for the animals and following the caretakers around. Sometimes we have our sick animals and we would see some of the zoo vets come in to treat them, and I thought it was quite cool.
Right.
Yeah.
So, you must have had quite a lot of passion in this, because it's not easy to be a vet as well, right? There's no vet school in Singapore, so you have to go overseas to study and all. So, was it a great burning passion that you had for the industry?
Yes. You could definitely say that. What also reaffirmed, why I wanted to become a vet was after, seeing the zoo vets, I inquired more about the profession, found out that, of course, like you said, there's no vet industry in Singapore, or there's no vet school in Singapore, so I had to go overseas. But I volunteered at a clinic that was quite near my place, and then I really enjoyed my time over there. Yeah.
Okay, so do you have any pets, and do you favor any particular breeds or species?
Okay, so growing up, I was very much a dog person. I have 2 Chihuahuas and a Golden Retriever growing up. That changed after I met my wife. She converted me into becoming a cat person. We have a 4-year-old British long hair called Rainer, who we love very much.
Oh, that's nice. British long hair, we don't see that often, right? Usually you see British short hairs.
Yep. So it's basically a British short hair cross with a Persian. Yeah.
Oh, that's nice. Nice. So, do you have any particular area of interest?
I would say internal medicine. I have a big passion for internal medicine. So that involves, doing like blood tests, anything that's non-surgical, and trying to diagnose our patients. I like ultrasound a lot as well, and cytology, which we can touch more later.
All right, cool. And what are the 3 most important things that you would like pet parents to know?
So number 1 will be, and please ensure that your pets are up to date with their vaccinations and with their deworming medications. Remember that vaccines are something that should be given yearly, and not just whenever when your pets are puppies or kittens. Number 2 will be to really pay attention to your pets' everyday routine. So, know how much they eat per meal, know how much they rest every day, and pay attention to their urinating and their drinking habits, because oftentimes with disease, there are subtle changes in these habits which you will need to pick up on. Okay, and number 3 will be to, when you bring your animal for a consultation, please be as detailed as you can with their presenting symptoms. Bring pictures, bring videos, bring samples. If your pet is having diarrhea, bring samples of their poop. It's the only profession where we can say we appreciate poop. Yeah.
Okay, and I'm just wondering, because you touched the first point regarding vaccinations.
Yeah.
And the importance of it. I mean, if we've seen many episodes as well that vets stress on the importance of vaccination. But what if the pet is allergic to the vaccination? Then what can pet parents do?
So if the pet is allergic to the vaccination, there can be a couple of reasons, of course. The brand of the vaccine plays a role in whether or not an animal is allergic. So, if your pet has had an allergic reaction to one particular brand of vaccine, you can always try another brand. Another thing is we can give things like antihistamines, or we can give things like steroids, either a couple days or a couple hours before the vaccination to hopefully try and reduce the likelihood of an allergic reaction. For some of our pets as well, we will keep them under observation for a period of time after the vaccination just to make sure that they are all okay.
Okay. Thank you, Dr. Kevin. So let's move into the main topic for today, which is our diagnostic testing. So we'll start with the basics. What exactly is diagnostic testing in the context of veterinary medicine, and how does it differ from simply observing symptoms?
So diagnostic testing in a nutshell is taking a series or selecting a series of diagnostic tests based on the information the pet parent has given me and based off what I find on my physical examination to try and come up with a definitive diagnosis, or at least narrow down my list of possibilities of conditions that could be affecting my patient to, a handful of possibilities as well. It's different from just simply observing the symptoms, because number one, pets can sometimes mask their symptoms of illness very well. And this is particularly true with cats and masking their illness. There are also lots and lots of different possibilities for a particular symptom. Of course, there are things that are a bit straightforward. If an owner comes in and tells me their dog has gotten bitten by or got into a fight with another dog, I see a wound, there's not many other possibilities as to why that's presented like that. But if you have an animal that's come in for, say, vomiting is a very, very common presentation for animals in Singapore. It can range from things like a simple case of a tummy upset to things like liver disease, even brain disease, kidney disease, even something like an intestinal obstruction, which then may require surgery. So that's where diagnostic testing comes in to tell me how severely affected your animal is, and do I think your animal can be treated as an outpatient at home, you just give the animal some medicine, or do I think he or she needs more aggressive therapy?
Okay. And what are some common reasons a pet owner may bring their dog or cat to the vet where diagnostic testing then becomes necessary?
So vomiting, like I mentioned, very common, diarrhea, diarrhea with blood or blood in the urine, changes in their peeing or drinking frequency, changes in their behavior. Cats and dogs will sometimes hide as well, and that can be a sign of illness. The other more common ones would be things like if an animal is panting too much or they're having any difficulty breathing. Those will be the more emergent scenarios.
Okay, and how can early and accurate diagnosis significantly impact a pet's well-being and longevity?
For certain disease processes, like for example, I'll bring back kidney disease, for example, which is something that we see very commonly in Singapore. When it's detected early enough, usually our pets are not showing such severe clinical symptoms. In the later stages is where, you get pets really coming in very sick, they're vomiting, they're losing lots and lots of weight, and those pets are at a higher chance of going into a critical state. So by detecting our conditions early, we can make recommendations, change the pet's lifestyle, be it their food, be it giving them supplements in order for us to stabilize their condition before it gets to a point where emergency medical attention is warranted.
Okay, and can you explain the difference between preventative care and diagnostic testing when a pet is showing symptoms?
Yeah, so preventative care would fall under things like I mentioned before, vaccination, deworming, annual health checkups. Those things aim to catch problems or catch diseases before they actually become problems. So they serve as a means to, number one, in the case of vaccination and deworming, to protect our animals, our pets, from diseases that are well documented to be fatal to them. So things like parvovirus, which is really, really fatal to our puppies, can be prevented by vaccination. Number two, also, it can serve as a means for us to detect things like organ dysfunction, detect things like kidney, liver disease before the pet starts to show clinical signs. It's also a means for us veterinarians to really examine the pet and look for slight things that the owners may have missed or may have thought to be non-important, things like small little bumps around the animal's body. Sometimes some owners may look at them and just think that they could be part of like old age change for the animal, when in fact it could be a problem. And it also gives us vets a chance to, touch base with our owners and address any potential concerns that they may be having about their pet. So that's preventative care. In the way of diagnosis or diagnostic testing, it's when an animal who is actively sick or ill presents to us, and we are trying to figure out what is actually causing the illness for that animal. So in the ways of testing, for cases where it's preventative care, we might opt to do just like a general health check bloods, just to have a look at the animals, things like their liver or kidney function. Whereas if we are talking about diagnostic testing for a sick animal, we may opt to do more extensive tests as well to try and come up with a reason for why our animals are not feeling well.
Okay, so Dr. Kevin, let's move on to the details of certain more common tests that are being done. So we'll start first with blood tests. So how are they done, and what kind of information can they provide the vets?
So blood tests generally, as the name suggests, we take blood from an animal. We will run it through our in-house or in-clinic machines. And the information that's provided would, be things like I keep on touching on this, the kidney, the liver function, things like their pancreatic function as well. We may also have an idea of their blood count, so to see whether our pets are anemic, as well as their platelet and white blood cell count. So it gives us a pretty basic but, good idea of the health status of our pets at that point in time.
So can we say that a blood test at least provides the vet with a general indication whether a pet is sick? So for example, if a pet is sick, something in the blood test would look wrong. Would that be the case?
In most cases, yes. Of course, there are some limitations with our just general blood test. So things like if there's any intestinal disease, if there are any, slow growing cancers, we may not be able to detect them on our basic blood tests. And that's where, additional diagnostic testing like x-rays, ultrasound, or in some cases, even external laboratory tests come in.
For the blood test wise, do the vets normally do it occasionally or when they came back for some health checks?
So my cutoff for when I start to recommend blood tests for an animal is when they reach at least the age of 7. That's where I term the animal to be going onward towards a geriatric or old age. So past the age of 7 is when I would recommend at least a yearly blood check for the animal. Depending on what we find on the blood test, we may opt to do more frequent checks, maybe every 6 months, every 3 months. Before the age of 7, really only if the animal is actually presenting with sign of illness, then I talk about doing blood tests for them.
Okay. But so owners can request for it even earlier than age of 7?
Definitely. We can do blood tests on any animal of any age at any time. Yeah.
Okay. So blood tests wouldn't be considered as a invasive test, right?
No, not at all. No. Very well tolerated by our animals.
Okay, and I think the other thing that a lot of pet parents also are concerned about is the cost. So what is the cost that they're looking at for a blood test?
So for a general blood test, which looks at the above things that I mentioned, you may be looking between $250 to $350 just for a general blood test. If we are honing down on specific markers of organ function, so say we only want to look at maybe the liver or maybe the kidney, you could be looking somewhere towards $100 to $150 for something like that.
Okay. All right, let's move on to our next test, which is the urinalysis. So tell us a bit more, what is it about? What does it test for? Yeah.
So a urinalysis test will generally look for the presence of things like bacteria in the urine, which in our animals that present with blood inside the urine, you may find some bacteria in there. We look at protein in the urine as well, which can sometimes be a sign of either bladder inflammation or can be a sign of kidney disease. We will look at things like glucose in the urine, which can point towards something like diabetes for our animals. We also look at the concentrating ability of the kidneys or the urine concentration. So say if you have an animal that's vomiting and not eating and is dehydrated, you'd expect the urine to be quite concentrated, quite dark. Whereas if we take urine and it's not so concentrated, that can be an indication that the animal's kidneys are not working very well. Okay. We also look at crystals inside the urine, which are little sediments or little particles that can be found in the urine, which in large amounts can cause bladder stone formation.
Okay. And how is the urine normally collected?
So there's a couple of methods. If we are wanting to look for bacteria in the urine, we generally recommend a procedure called a cystocentesis. So we use an ultrasound, find the bladder, and stick a needle into the bladder to collect urine that way. That ensures that our urine is at its most sterile possible. If, the animal were to pee on the floor and we grab the urine from the floor, oftentimes it's contaminated with bacteria from there. If we are looking for things like protein, things like glucose inside the urine, we don't need to do such invasive measures, and usually we'll just get the owner to take the animal out for a walk, just collect some urine when they pee, and then we test that urine.
So like you mentioned just now for the cystocentesis, right, do they need to be anesthetized?
I would say 99% of the time, no. Most animals tolerate the procedure quite well. And in fact, my clinic does it on almost a daily or every other daily basis. The very nervous animals and the ones that can be quite aggressive in the clinic, yes, we sometimes offer to give them a small amount of sedation, but those are rare cases. Yeah.
Okay. And what is the cost that pet parents should expect for a test like this?
So if our purpose is just to run an in-house or in-clinic test, you could be looking at about $100 in total. If we want to take our test a step further and do what we call a urine culture, that's a test where we send off the urine to our external labs for them to analyze, let us know what kind of bacteria could be in the urine, as well as what kind of antibiotics can be used for the bacteria. You can be looking upwards from $250 in total for that.
Okay, so just now you also mentioned that if you're testing maybe just for glucose and all, you will not need such a no need a procedure for it. So it's kind of like a free catch kind of method. So if pet parents know that they're coming in for it, can they actually collect the urine beforehand and then bring it to the clinic? Is there a time frame that they must bring it?
Yep. So there is a time frame. Generally, I would recommend to have urine within the hour of your consultation. Any longer, we might get some false results, especially if you're looking at things like glucose or protein or the presence of sediments or crystals inside there.
Okay.
I just want to check because for dogs and for cats wise, dogs, I think pretty easy for them to collect the urine for the owners. But because for cats wise, normally they pee at the sand or in the bedding. What's the best way for cats owners to collect their urine?
Yep. So cats are a lot trickier than dogs, definitely. Well, it can be difficult for cat owners to collect urine. There are some things that you can purchase online where it's like little glass tubes that serve to act as like litter, and cats can sometimes mistake those glass tubes for being litter and then pee on those glass tubes. So none of the pee actually gets absorbed into any litter, and then they bring the whole litter tray as a sample for us. But usually cats are a bit smarter than that, and they realize that, it's not their usual litter. So I would say majority of the cats, when we choose to collect urine, we either have to go ahead and do that cystocentesis procedure, or the other one will be the other possibility is that if they are not so stressed out in clinic, we can actually squeeze their bladder and express their bladder in clinic and collect a sample that way. So it's just a gentle squeeze of their bladder, and after a while they will urinate for us and we can use that sample.
Will it cause any pain?
No pain if we squeeze the bladder, no. I mean, for our really stressed out cats, they will, of course, hold in their urine, and squeezing the bladder may not be possible, but majority of the cats are okay with this procedure.
Okay. So let's move on to the next one, which is the fecal test.
Yeah.
So tell us a bit more about the fecal test.
So
This podcast is proudly sponsored by Hill's Prescription Diet. Is your pet's digestive system giving them the blues? Loose stool and other tummy troubles can be negatively affected by many things, and when your pet has digestive upset, it's a thoroughly unpleasant experience for everyone involved. The good news is that you can help your pet feel better with Hill's Prescription Diet GI Biome. It is clinically shown to help firm loose stools in 24 hours. It contains a special blend of prebiotic fibers to help support a healthy microbiome, leading to firmer stools and healthier pets. Visit your vet to learn more about how Hill's GI Biome can improve your pet's digestive well-being.
Fecal test, as I said, vets, we love poop. So fecal testing, we mainly are looking for infectious diseases with fecal testing. So you're thinking of things like bacteria, things like worms in there. Some tests also can look for the presence of viruses inside. As I mentioned, parvovirus, a big concern for our puppies with diarrhea. So that's generally where we use fecal testing. The fecal tests, usually when pets present to us, they don't have any feces in the bowel, so we will encourage owners to bring a sample of feces beforehand. The most recent bout of feces that your pet has had. Yes.
Is there also a time frame similar to the urine?
Not so much for the feces. Of course, we would prefer not to have feces that was excreted a week ago just from a smell point of view. But within the last 24 hours, it's completely fine. Yep.
Okay. So regarding the fecal test, what kind of cost are pet parents looking at?
So it can range. If we're looking at an in-house or in-clinic fecal test, and we're just looking for, say, the presence of worms in there, you might be looking at about $60, $70 for something like that. If we want to do more extensive testing, you might be, and we want to send off the feces to our labs to analyze, you can be looking upwards from $200 to $300 for such tests.
All right, so we'll move on to cytology and histology. So I think many pet parents also would be this is quite a big word, right? So Dr. Kevin, could you maybe explain to us a bit what is cytology and histology?
Yep. So cytology is essentially microscope work. So we get a sample from your pet's lesion of concern, be it a lump that you found, or be it dirty ears, or even their blood sometimes, and we look at it under the microscope. What we are looking for are clues or things that tell us what could be going on that's causing, your pet to have this lump or your pet's ears to be infected. So things like cancer, things like certain types of inflammatory cells, as well as things like bacteria, fungus, can all be quite readily diagnosed via cytology. Histology is similar to cytology, but it's a bit more complex in that it's mainly done by a pathologists who work in an external laboratory. So we usually send over some samples to them, and then they use very high powered microscopes with different techniques to actually come up with a diagnosis and to see what's going on with the animal.
So normally what kind of symptoms do the pets present for the vets to decide to do a cytology or a histology?
So any kind of ear infection, I would definitely recommend a cytology. So just to see what kind of bacteria is in there, whether there's fungus in there, things like that. For histology, I would reserve that mainly for lumps that we find. So lumps that we are either fast growing or lumps that, grossly when you look at them, they appear to look quite inflamed, quite angry. I would reserve histology for that. So I would actually send off those samples to get analyzed to see whether or not is there cancer in there, or is it just, a really bad case of inflammation.
So how are the samples usually taken?
So the samples will have to be taken surgically most of the time. Your pet will need either to be heavily sedated or to undergo a short period of general anesthetic. We cut out the samples we need, and of course we stitch everything back together. We pack the samples in a small tube that contains formalin to preserve the cells, and then we send it away. And usually within a week or two, we get our results back.
Okay, and this is more for histology, right?
Yes.
How about cytology? How is it usually taken?
So for cytology, usually it's taken via if you're talking about lumps, usually it's taken using a needle. So we attach a needle to a syringe, poke that needle into the lump, and then afterwards get a small sample. You're talking about just a little dot of what represents the lump. We put that onto a glass slide and look at it under the microscope. Yeah.
Okay, and so what kind of costs are pet parents usually looking at for this test?
So for cytology, you could be looking maybe about $100 if we're assessing a lump. If we do need to send the lump away for analysis, you might be looking upwards towards $300 for assessment of a single lump. Yeah.
So let's move on to the next one, which is food trial. So I think what's pretty interesting is that when we talk about diagnostics, most of us would think that, okay, it's imaging, it's like blood tests, but we won't think of food trial as a diagnostic tool.
Yep.
So maybe you could tell us a bit more about that.
Yep. So food trials are mainly used to detect food allergies, or more specifically food intolerances with our animals. So these animals usually present with signs like either vomiting or diarrhea, or they can present with things like itchy skin. So oftentimes pet parents are a bit frustrated because it's usually a chronic presentation of clinical signs, and nothing they seem to do seems to really work for their animals. They just keep on getting these signs back again. So what we do is that we will either put them on a hypoallergenic prescription diet. So it's a diet that contains what we call a hydrolyzed protein. That's a protein that's broken down into really, really small molecules such that the body is not able to detect those molecules at all. We try them on that diet, or we try them on a novel protein diet. So it's basically a protein that your animal has never had before. Usually they are quite exotic meats, like things like crocodile, things like venison. And we see after 6 to 8 weeks with an animal that's strictly on those diets, whether or not there's any improvement in their clinical signs. If there is an improvement in the clinical signs, we can either just assume that they have a food intolerance and keep them on the diet for life, or B, try to switch them back to their regular food, see are they going to show signs again, because if they show signs again once you switch them back to their previous food, that confirms the diagnosis of food intolerance.
So for a food trial like this, the pet parent cannot feed any other thing other than the food, is it?
Yes. So if you're looking at the case of a prescription diet, a prescription hypoallergenic diet food trial, there are various different diets that we can use. So there's two brands. There's the Royal Canin hypoallergenic diet or the Hills ZD diet. Both of those brands will work equally fine and can definitely be interchangeable. So those are the two brands that you will have to stick with for your food trial.
So pet parents need to remember, don't feed additional treats during this because would it significantly affect the results of the trial?
Yes. Because we are going into this, not knowing exactly what your pet is allergic to and how allergic they are to it. To said protein, rice, whatever. So if your pet is allergic to chicken and you feed them just a small amount of chicken, it's going to falsify the results quite greatly.
Okay, and what kind of costs are pet parents looking at for something like this?
So largely depends on, of course, the size of your pet and how much food they need. So for smaller breed pets, for a 6-week food trial, you might be looking maybe about $300, $350 for the whole 6 weeks of food trial. For larger pets, of course, you could be looking maybe $600, $700 in total, depending on how much your pet needs to eat as well.
Okay. All right, let's move on to the last one that we'll be talking about, which is diagnostics imaging. So that covers that full array of X-rays, ultrasound, CT scan, MRI. So you can tell us a bit more about this.
So diagnostic imaging is something that we do, well, particularly X-rays and ultrasound is something that vets do quite regularly. So, for X-rays, I would say are important to be as part of a general health check for your animal. X-rays give us a really good overview of what your animal's body systems look like. So tells us about the size of the animal's heart, whether or not there's any changes in their lungs or abnormalities in their lungs, or unfortunately whether or not there's any tumor in there. Can tell us about the size of their other organs like kidney, liver, bladder, that sort of thing as well. So it gives us a very good overview of what the animal looks like internally. The ultrasound lets us look at the internal structures of each of the organs. So it helps us look at the texture of the liver, textures of various organs to see, are they healthy or is there any kind of abnormality that could be present? So both used, in tandem together, provide a really good idea of an animal's health status. Ultrasound is particularly good because, let's say we take the liver, for example. For an animal to show signs of liver disease, their liver would have to be quite significantly affected. So we have had patients where clinically they are completely healthy, there's no issues, but they've actually got some quite significant pathology or disease going on with their liver, and that's helped us to detect things early. MRI and CT scan are more reserved for, CT scan is more reserved for patients that, we want a very detailed idea of what their internal structures look like. Whereas if we are looking for, things like small tumors that X-rays and ultrasounds cannot pick out, that's where we can use CT scan for. In patients with spinal disease as well, especially diseases of the spinal cord, X-rays and ultrasounds just aren't able to detect those sorts of diseases. So that's where we look at CT scans and MRIs. And particularly for cases where neurological cases where patients have seizures or changes in their attitude, we sometimes will recommend MRIs to detect those diseases.
Do patients need to be sedated for these tests?
Generally, for X-rays and ultrasounds, patients may not need to be sedated. Of course, this depends on how nervous the patient might be. So if a patient is going to be extremely nervous and moving around a lot, of course we may not get as clear images as we would like, and that's why we opt to sedate our patients. I would say majority of our patients, we don't actually need to sedate them, even for the scan and for the ultrasound as well. For CT scan and MRI, yes, we will need to sedate or put our patients under a short period of general anesthetic to carry out those procedures.
So, what about pet parents who are afraid to let their pets go through this test because they're scared of the radiation exposure? Because they feel like, oh, my dog and cat is so small, and then like you put them through this machine, and also
So look, that's definitely a concern. I will say that oftentimes we don't need to x-ray our patients so often until it's actually generating any carcinogenic or cancer cells within them. One x-ray can give us, or one or two x-rays rather, can give us a pretty good idea of what our patient's health is looking like at the moment in time. So I would say it's not a big concern, especially if you're weighing the pros and cons of x-raying a very, very sick patient. If there's a real worry for their pet parent to undergo x-rays and CT scans, then that's where I'd recommend an ultrasound, because there's no carcinogenic material that can be generated with an ultrasound.
And what kind of cost are pet parents looking at for this test?
So for x-rays, you'll be looking about $100 to $120 per x-ray. Usually we take between 2 to 3 x-rays generally. So say $300, $240, something like that. For an ultrasound, you can be looking, if we're just zooming in on one specific organ, you can be looking at maybe about $150 for that. If we're doing a full ultrasound for your animal, it can be upwards from $350. For CT scan and MRI, you can be looking anywhere between $1,800 to say $4,000, depending on what exactly needs to be scanned.
Yeah. So, from our understanding, is it right that basically X-ray and ultrasound usually gives you a idea of what is going on already? But if there's something that you suspect that you need a clearer picture that may not show up on X-ray and ultrasound, then that's where CT scan or MRI may come into place.
Yes, that is right. And particularly for bone ligament disease, if there's any conditions with the ligaments or tendons, sometimes that doesn't show up very well on the x-ray, and that's why we recommend a CT scan. And anything that is neurological, so anything that's within the brain and the spinal cord, x-rays and ultrasounds are not great for detecting those diseases.
I just want to check out for ultrasound, CT scan and MRI, does all the vets in Singapore know how to do it, or they have to go for certain course to certify that they know they are able to do this?
So for the ways of CT scan and MRI, not all clinics will offer that. Usually the clinics that offer it will send their reports over to an external radiologist for interpretation. So, but they will actually do the scan, the CT scan and MRI themselves. For ultrasound, well, there are some vets that will go overseas and do courses to get more expertise in the ultrasound. For a basic ultrasound, that we are taught that to a small degree during our veterinary course, but that is something that vets will learn on the job as they progress as well. Yeah.
Okay. And what if there are some pets who are especially fearful or aggressive? So how do we perform tests on them? Like any of the tests that we mentioned above.
Yeah. So some fearful or aggressive pets, first of all, we try to get their owners to come in to see if they are able to calm the animal down to a point that the animal is tolerant of us doing those tests. If that is still not possible, then we either, number one, will send the animal home, give the owners a calmative or a pill to give the animal before their vet visits, and hopefully that will calm the animal down. If that is still not an option, then we may have to lightly sedate our patients in order for us to get the samples that we need.
Yeah. So let's talk a bit about preventative diagnostics, right? We touched on that a bit just now, but what are some of the key diagnostic tests that would usually be done during an annual checkup?
So key diagnostic tests would involve things like, as I mentioned before, a general health blood check. So that will look at kidney, liver, whether there's a sign of anemia, whether there's a sign of infection with your animal. I would also generally do an X-ray. Heart disease is very common amongst our smaller breed dogs in Singapore, so that's something that we need to pay attention to. An ultrasound also may be warranted if there's any abnormalities within the X-ray. And the last one will be a urine test, just to make sure that the animal's kidneys are working fine and that the health of the bladder is okay as well.
So are there any specific breeds or ages of dogs or cats that may require more frequent or specialized diagnostic testing?
Definitely. So you have some breeds are more prone to certain types of diseases. So for cats, for example, British Shorthairs and Ragdolls, very, very popular in Singapore. They are prone, unfortunately, to heart disease. So for our British Shorthair cats and our Ragdoll cats, as they get older, we may opt to have a look at their heart function to see whether there's any abnormalities within them as well. As I mentioned before, smaller breed dogs, your Chihuahuas, your toy poodles, your Maltesers, they are prone to getting heart disease as well. So we will, as they get older, pay careful attention to their heart sounds when we do a physical examination for them, and we may recommend things like a heart scan or an ultrasound of the heart if we detect any abnormalities. Of course, you also have things like your bulldogs, which may require sometimes a sedated examination just to have a look to see if there's any airway issue, any soft palate issue that could be restricting their breathing as well. Yeah. Another one will be your larger breed dogs, so golden retrievers, German shepherds. Unfortunately, they are prone to developing splenic cancers as they get older. So I will do an ultrasound for any older, larger breed dogs that I see, or I will at least recommend it. Yeah.
Okay. Mm-hmm. And could you share a case where diagnostic testing played a crucial role in saving a pet's life, or at least helped to significantly improve their quality of life as well?
I had a patient last year who came to me for, just vomiting, being generally unwell, and being more lethargic than usual. We did some blood tests on that patient. So we did a complete blood count, which looks at signs of whether or not my patient has any anemia or any infection. And we did an organ function test for her as well. And we found that she was quite severely anemic. So had quite a low blood count and quite a low platelet count as well, which is her ability to actually clot blood. So on the ultrasound, we then proceeded to do an ultrasound for her. We found that she had a pretty large splenic tumor that was actively bleeding at the time. So I think it measured about 5.6 by 6.4 centimeters, which is quite significant. So we then, brought her into surgery, removed the tumor, and, thankfully she made a pretty good recovery. Even to this day, she is still alive. So, if we hadn't done any diagnostic testing, I wouldn't have had the confidence to even recommend something like surgery to her owners. And, we could have easily lost her within the next 1-2 days if we hadn't acted quickly.
So that also goes back to the part where pet parents, what you mentioned, the 3 most important things, right? To really notice small changes even in your pets that could make a big difference from early diagnosis to something that is already late stage.
Yes. I mean, of course, there are situations where pets very quickly go into an emergency state. Something like, in this scenario, if you have a bleeding tumor that can deteriorate your pet quite quickly. But yes, generally, notice the differences in behavior of your pets.
And so what are some red flags that pet parents should look out for that should indicate that I need to bring to my vet for testing?
So things like, of course, vomiting, diarrhea, inappetence or not eating are some things that should alert you. Changes in their peeing or drinking as well. If there's any increase in frequency of either of those two, you should at least give your vet a ring. An important thing as well is weight loss. So weight loss, despite your animal having a good appetite, is a big red flag to me. Because that shouldn't be the case, especially if you're not actively trying to make your animal lose weight. So it can be difficult for pet parents to, visually look at their pets, especially the really fluffy ones, because, you see them every day, you're not able to detect subtle changes in their weight. So what I would recommend is, if you can maybe weigh your pets once a week or once every 2 weeks just to track their weight as well. And if you do notice that they are slowly losing weight, that should alert you to bring your pet to a vet.
Okay. And how has veterinary diagnostic technology advanced in the recent years? And how does it benefit pets and their owners?
So veterinary diagnostics, our main aim is preventative medicine. So we are wanting to detect problems before they actually, become an issue for our pets. Unfortunately, some of the markers that we use to measure things like kidney function can be affected by external factors. So things like the hydration status of the animal, the kind of diets they have, whether they've got a high protein diet that can sometimes falsely increase some of the readings. In the recent years, there have been more specific markers that have come up that we can use more reliably to detect whether an animal actually has kidney disease or has any kind of organ dysfunction. So that gives us more confidence to say that yes, I believe your animal is starting to show signs of kidney disease, and we should do a bit further testing, or we should actually intervene before it starts to become a problem. A lot of clinics now, or more and more clinics, are starting to offer endoscopy as a means of getting diagnostic samples. So for animals that need, say, an intestinal biopsy, where traditionally you actually have to do open surgery just to get a sample of their intestines. Sometimes now, there's the option of putting in a camera into the intestines. No need for any cutting open of your animal, and then getting a sample that way.
Oh, so it's done similar to, is it like the human way where they
very similar, yes, very similar.
So the pets need to be sedated, or they are...
The difference is that the animal will have to be under general anesthesia for this procedure. Yes. But compared to the previous method of actually doing open surgery, the recovery time is a lot faster, and pets do tolerate this procedure quite well.
Okay. Yeah, I think it's... Sorry, go ahead.
Sorry, Dr. Kevin, if you are talking about early detections for pets, is there a time frame that probably pets owner needs to know, yearly checkup or half yearly checkup for their pets?
So I will say when your pet reaches the age of 7, which is where I would determine them to be going on towards a geriatric age, maybe consider a yearly checkup for them. I mean, in reality, because we should keep our pets up to date with their vaccinations every year, you ideally should bring your pet in at least once a year for a checkup. But from age 7 onwards is where we want to do things like blood tests to see, do we need to see your pet more frequently, or can we still stick to this yearly checkup? Okay.
Right. So great. Let's move on to pet insurance. Yeah. All right. So why is pet insurance particularly important in Singapore, considering the cost of veterinary care?
So pet insurance is not just a Singapore-specific problem. I would say it's an international problem. Owning a pet, though it can be very rewarding and enjoyable, comes with quite a huge responsibility. And part of that responsibility is ensuring that your pet has the best quality of life possible that you can give. Some pets, unfortunately, are a bit more prone to developing illness than other pets. For example, you have your young Labradors and Golden Retrievers that will just eat just about anything and then develop vomiting, diarrhea. Sometimes they eat things that are toxic, and then we need to make them vomit out said material. So the repeated costs of veterinary visits can definitely pile up for pet owners, and that's where pet insurance comes in to hopefully mitigate some of those costs.
So what are some key factors that pet parents should consider when choosing a insurance plan?
So the type of coverage is very important. How much surgical and hospitalization coverage the insurers will provide. Their deductibles and their premiums as well are pretty important. And whether or not there is freedom of choice for the veterinarian. So whether you're able to just go to any veterinarian, or whether there's a specific vet/clinics that you need to go to in order to make the claim.
Oh, right. So it's like the human ones where there's a panel of doctors that they can go to?
For some of them, yes.
Okay.
Does pet insurance cover reoccurrence?
Reoccurrence meaning?
Like for example, for human, when we do a claim for cancers, we can't do a second claim on it. For pets, similarly,
pet insurance can cover recurrence of certain problems as long as they are not pre-existing conditions that the dog or cat has had, before you actually sign up for the pet insurance. So usually, the insurer will give you a form for your veterinarian to fill out to say what pre-existing conditions the animal might have and the health status of the animal at that point in time, and then that's how you start signing up for your pet insurance.
Okay. And how does pet insurance help with costs associated with diagnostic testing, like what we were talking about just now?
Yeah, so diagnostic testing, depending on the severity or how sick your animal is, the range of tests that we might select can be quite vast. So, it might be that your pet just needs maybe one, test of his or her urine, or it might be that we need to take a whole myriad of tests to figure out what's wrong with your animal. So the cost can definitely pile up, especially if we are having to do multiple tests at once. So that's where pet insurance will help with said costs. Yeah.
And maybe we could talk a bit about emergency situations and hospitalizations as well, because we also understand in companion you do see quite a lot of emergency and hospitalization cases. So how crucial is pet insurance for these cases?
I would say it's probably the most crucial in those cases. Yes, you are right. We are a companion animal surgery is a 24-hour hospital, so we see emergencies, I would say weekly to even twice weekly. In those scenarios, in order for us to really most effectively treat the animal, we do need to do quite a high range of diagnostics in order for us to get a really good picture of the animal, because in some animals it's a matter of if we don't intervene within the next 1 to 2 hours, they can really start to deteriorate. So costs will definitely add up from doing those diagnostic testing. If you are coming to the clinic for an emergency after hours, so past 12 midnight, there is generally a surcharge as well, which also adds on to the cost. And not to mention, the hospitalization costs and the cost of the treatment, the actual treatment as well. Yeah.
So what advice would you give pet parents who are considering to purchase a pet insurance?
I would say have a chat with, of course, number one, have a look, go and compare the different types of coverages that are provided by each company. Number two is that you can have a chat with your veterinarian, to see weigh the pros and cons of pet insurance, and to see whether or not it's something that in the long run can save you some money lah.
We have also spoken to one of the vets in our previous episodes as well that did mention about pet insurance also, that the coverage is a lot lesser than overseas. In terms of like there is a lot of limitations as compared to overseas pet insurance. Do you have that same view as well?
I unfortunately don't have a lot of experience with overseas pet coverage. But what I will say is that the main, I guess some of the limitations will be that pet insurance doesn't cover things like skin conditions, things like, birth issues, certain types of birth issues, and like I mentioned, pre-existing conditions. Generally, pet insurance will not cover those things.
Right. So when is the best time to get pet insurance?
As early as you can. Yes, the younger animals are the ones that are more prone to, being curious and eating things and getting into trouble. And those are the animals that you'll have to take to the vet more often compared to the older animals. So yes, as soon as they are eligible for pet insurance, I would get that for them.
All right. Thank you so much, Dr. Kevin. Do you have anything to add on to the pet parents?
Well, I would say if you ever feel like your pet, is not looking right, or if you ever are concerned about your pet, don't hesitate to give your nearest veterinarian a ring, because, we would rather listen to you and tell you and advise you if you need to come in rather than have you wait and have your pet deteriorate as well.
All right. Okay. Thank you so much, Dr. Kevin. Thank you, everyone. We'll see you guys in the next episode. All right. Thank you so much. Great.